I was pretty sick for a good couple of weeks. Very phlegmy, aching all over, fever.
Nancy Williams thought it was just a cold when she got sick last year. Instead, she had contracted respiratory syncytial virus.
I was not able to leave the house. It was hard, I live alone.
RSV usually causes mild symptoms, which include coughing, sneezing, fever, and decreased appetite and energy.
So RSV is a respiratory virus that affects thousands of people annually. It circulates between October and May. There are 23,000 hospitalizations annually for RSV in Canada.
By the age of 2, most children will have experienced an RSV infection. However, infants, people aged 65 and older, and those who are immunocompromised are at a greater risk for developing more severe forms of the illness.
If you end up in the hospital with an RSV infection, and if you survive, the chances of you leaving the hospital in the same condition that you entered, that's slim.
The mortality rate, unfortunately, in patients who had RSV was about 30%, and that compared to about 26% in those who had influenza and about 9% in the general population.
Doctors say approved RSV vaccines could make a difference in the year ahead.
The complications of RSV can be prevented because there are vaccines available. So there are vaccines that are licensed for people either over the age of 50 or over the age of 60. So it is possible to prevent these complications.
Coverage for the vaccine is not uniform across the country and can be as much as $350. Doctors say they still encourage patients to think about getting vaccinated.
There's also a cost to not being vaccinated. And if you ask any patient who suffered from a vaccine preventable disease, they would pay anything to go back in time and provide themselves coverage.
Katherine Ward, Global News, Toronto.